Anyway, doctors arriving. Speed up the stream. It started on my end.
The president has continued to improve.
All right, let's hear what the fuck they have to say.
Exceeded all standard hospital discharge criteria. He'll receive another dose of remdesivir here today, and then we plan to get him home. It's been more than 72 hours since his last fever. Oxygen levels, including ambulatory saturations and his work of breathing, are all normal. Though he may not entirely be out of the woods yet, the team and I agree that all our evaluations, and most importantly, his clinical status, support the president's safe return home, where he'll be surrounded by world-class medical care 24/7. I'd like to bring Dr. Dooley up to review some more specifics.
I cannot believe this motherfucker's getting out of the hospital for 3 days in. It is insane, dude.
As Dr. Connolly mentioned, the president.
It is so dumb and so insane.
Very well. His vital signs this morning were notable for a temperature of 98.1. His blood pressure was 134/78. A respiratory rate of 17.
He hasn't even tested negative yet. Oh, squirrel.
Beats per minute. And his last oxyhemoglobin saturation was 97% on room air. He currently does not endorse any respiratory complaints. And aside from our evaluation with the multidisciplinary team this morning, has maintained a full schedule, ambulating and working on the White House medical unit. I'll now turn it over to Dr. Garibaldi to again discuss therapeutics. Thanks.
Hi, good afternoon. And again, I just wanted to echo the sentiment of what an honor it is to be part of this wonderful team here at Walter Reed. Yesterday evening, the president received his third dose of remdesivir. He tolerated that infusion without difficulty, and his kidney and liver function continued to be normal. Our plan is to give the fourth dose of remdesivir this evening before he goes back to the White House, and we've made arrangements to deliver the fifth and final dose of his treatment course at the White House.
Like, he left before.
He continues on dexamethasone.
He left before his remdesivir treatment is done.
To be up and out of bed, eat and drink, and work as he is able. And I'd like to turn it over to Dr. Jason Blaylock, who's an infectious disease specialist and the chief of medicine here at Walter Reed, to give some updates on infection control. Thank you.
Good afternoon, everyone. First of all, I just want to say what an honor it's been to be part of this medical team behind me and to care for the president. Since the president's arrival at Walter Reed, he's received medical management that remains in line with national clinical societal guidelines for treatment of COVID-19 infection. In addition, both myself and Dr. Wes Campbell have worked very closely with various laboratories in the area, state-of-the-art facilities to include USAMRIID and RARE on obtaining advanced diagnostic testing to really inform the White House medical team of both the status of the president as well as his ability to transmit virus.
Agent 47, your
also,
mission is clear.
We have worked very closely with the Walter Reed team to ensure that we are looking very closely at infection control prevention strategies and the right posture so that the president can safely return to his residence. And with that, I'm going to turn it over to Dr. Conley, who will answer any final questions.
Thanks, Jason. I mentioned it Saturday, but I'd like to reiterate myself just how grateful the president and I are to the men and women of Walter Reed, our colleagues at Johns Hopkins, as well as the many federal, private institutions that we've received support from. And so long as everything continues on the track that we're experiencing right now, this time, as the president already tweeted out, is to get him home later today. With that, I'll take a couple questions.
Discharged back to the White House when he was given steroids. You've said that he's still
This motherfucker is still positive, still getting remdesivir, and he's leaving the hospital. Insane. Complete insanity, dude.
So did you overtreat him? And if he's still on that medication, how is it safe for him to return to the White House?
So we send patients home with medications all the time. In fact, yesterday afternoon, he probably met most of his discharge requirements safely from the hospital. And he's returning to a facility, the White House Medical Unit, that's staffed 24/7, top-notch physicians.
He does
nurses,
look like Glenn
PAs,
Greenwald. Yeah, you're right.
And the unit here, the team here behind me is going to continue to support us in that nature. Yes?
What infection control measures are you taking? And how was it safe for him to drive around in a cloth mask yesterday? And how is it safe for him now to return to the White House where there have been so many cases? How is any of this safe?
So the the president has been surrounded by medical and security staff for days wearing full PPE. And yesterday, the U.S. Secret Service agents were in that same level of PPE for a very short period of time. We've worked with our infectious disease experts.
You're such a piece of shit when you're a doctor.
To make some recommendations for how
you're not a fucking doctor. You're a piece of shit. If you are justifying what the president is doing there,
he's going to be able to
just lie. At least lie and say he had antibodies already because he had it already. Like,
and I'll just say that
don't fucking be like the protective measures are fine.
Upstairs, for the last several days.
It's so fucked. You're such a piece of shit when you lie at the behest of the president like that. It's fine. It's fine. They had protective gear on. It's like, dude, there's still a massive risk.
I understand. The contact tracing, as I understand it, is being done. I'm not involved in that. So.
Why did you begin the speculation that he leave, or was this something he pushed for?
No. So we try to get patients home and out of the hospital as quickly as is safe and reasonable. Every day a patient
Yes, ladies and gentlemen, YouTube removed my strike.
Is a risk to themselves. And right now there's nothing that's being done upstairs here that we can't safely conduct down home.
You said that 7 to 10 days was a window that you'd be concerned about. I don't think we're there yet. So do you have concerns about potential worsening or reversal, and what are your plans for addressing that if it were to happen?
You're absolutely right. And that's why we all remain cautiously optimistic and on guard because we're in a bit of uncharted territory when it comes to a patient that received the therapies he has so early in the course. So we're looking to this weekend. If we can get through to Monday with him remaining the same or improving, better yet, then we will all take that final deep sigh of relief.
Look.
But as I said, 24/7 world-class.
This guy's gonna do exactly what the fuck. This guy's gonna do exactly what the fuck the previous doctor did. Okay, he's gonna run. He's gonna run for office after he's done with this.
How do you keep him safely quarantined?
I wish I could go into that more, but I just can't.
Doctor, when did you begin dexamethasone treatment?
So that has something to do. Yesterday we talked about that, the several little temporary drops in his oxygen, and we had discussed that as a team and elected to start it early in case that persisted or worsened. The potential risks and side effects we all discussed. We looked at the data and decided that we'd rather push ahead on it than hold and risk the opposite.
What about CT scans and chest x-rays? What have you seen on his
campaigning?
As far as travel goes, we'll see.
Mental status, can you talk to about whether he has any neurological symptoms? Does he have any side effects from his medications? Any fogginess from the virus?
No, I think you've seen the videos and now the tweets, and you'll see him shortly.
Most people with COVID are just told to self-isolate at home on their own. Why is this a big deal that he's leaving the hospital? It's actually a great question because most people with COVID aren't treated with fucking remdesivir in the hospital. Most people with COVID are told to self-isolate at home and come to the hospital if their conditions worsen. But once they come to the hospital and their conditions have worsened, they don't get fucking discharged, especially if they don't get, if they're put on remdesivir. And Donald Trump doesn't just have remdesivir, he has fucking 2 other experimental treatments on top of remdesivir. So he's a fucking petri dish of disease while he's simultaneously being pumped full of fucking the craziest cocktail of drugs. So it is a good question. He's getting VIP treatment right now. Okay? And if you're getting fucking VIP treatment, for you to leave the hospital as a public servant in the highest position of power is fucking insane. People in my town were kept in the hospital a minimum of 1 to 2 weeks. Yeah, like you're not allowed to leave the hospital, dude. You can't fucking do that. What do you mean? You're a clear and present danger to the safety of others if you're a fucking petri dish and you're like
exposure to the medical team.
I am concerned, but as the CDC says, there are caveats for essential
subtitles
employees,
are not working. Sorry.
That as long as you continue to test negative.
Yes, I have heard about the VIP syndrome. Yes, I'm very familiar with VIP treatments backfiring,
which we do inside the hospital 24/7. Then you can carry on your duties. Yeah.
The President's an impatient man. Has he been itchy to get out of here?
The president has been a phenomenal patient during his stay here, and he's been working.
He's so good,
hand in glove with us and the team. And
he's
today
so good.
got to the point.
He's the
holding
strongest
court
patient we've
with
ever had.
With those of us around him, the whole team, going over all the specifics, the testing.
I'm telling you,
what the
we
future
pumped
is.
him. We put tubes into his chest so he could blow oxygen
safe and what's
into the lungs of other patients. That's how powerful his lungs are.
That was beyond safe and reasonable practice that we all first wanted.
Medical team who recommended against the president leaving here and going back to the White House today.
No.
The president said don't be afraid of COVID. Do you agree with that? Should we not be afraid?
I'm not going to get into what the president says.
His heart, liver, and kidney function was normal or improving. Improving, does that mean that there were effects, and is it all normal? Like, what's up with that?
Yeah, it's all normal right now. I would say he appeared to be a little dehydrated Friday. He was able to just drink and recover from that, and yeah, everything looks great.
Campaigning out in the country, what sort of things do you?
Yeah, so the big first thing that we need to do is that there is no evidence of live virus still present that he could possibly transmit to others. And that's what the infectious disease experts and some of our partners, military civilian entities, doing some of these advanced diagnostics just to see as soon as we can identify that. Routinely, we talk about a 10-day window, CDC guidelines, but we're checking him more routinely than just waiting 10 days. There's a possibility it's earlier than that. There's a chance that it's a little bit later, but we will know as soon as possible. And then we will look at him clinically.
Kind of hard to believe anything this motherfucker says when he literally lied every single day so far.
Hydroxychloroquine to the president during his time.
And used the classic Trump example.
I'm not going to go into all of our
where he was
debates
like,
about
I was just
specific
cheerleading
medicines
so
and
that
therapies.
Trump
There
doesn't
are
get mad and his condition
dozens of
deteriorate when he
therapies that
hears
we
me
were
tell
made
you
aware
what
of,
his
that we
situation
considered,
actually
that we
looks
discussed
like.
and debated and looked at, the existing literature on. And this
Like,
is
that's
the
a thing that this doctor said.
Hydroxychloroquine.
He was like, yeah, I lied because if the president heard me say the truth,
No,
his
we were just
condition
talking
might
about What
worsen.
symptoms he has left, and he's even the slight cough that he used to have, he doesn't really complain of at all. He hasn't ever complained of muscle aches, and yeah, he's up and back to him all.
Okay, to be fair, like,
Monday, just
I
to be
think we're
clear,
being
how
a little
long
too
will he
harsh
still
on
be
this dude, though,
actively
overall.
shedding the virus?
And the reason why I'm saying
so
that is
this-
because there's a long history of these doctors lying about the president's
5
condition.
days,
Like,
the first 5
every
days of
fucking
illness,
doctor that takes care of the president
people
oftentimes
like this
has
shed
a
live
secondary
virus.
duty of lying to the public about it
reason
and
it was 10
underplaying
days is
it
because
always.
Most people by that time, after 7 days.
If you're familiar with the history of
most
American
folks
presidents,
don't
you know
have
this
multiple
already.
live
From
virus.
Ronald Reagan,
To 10,
I think
so
Woodrow
it's
Wilson was another
days.
one, right? Like there are so many presidents that they've literally lied about the condition of always.
I'm not going to put a specific number, but we look
George
at that,
W. Bush.
That window is all I say.
Will the president be confined to his residence, or will he be allowed to return to the Oval Office?
We're going to do whatever
FDR.
It takes for the president to safely conduct business wherever it is he needs to do within the residence and White House.
And is he on blood thinners? And also, has he been using? Have you been giving him Tylenol, Advil?
Oh,
Now-
that came
now-
up. I would like to say he has not been on any fever-reducing medications for over 72 hours. Yeah, he's on
of course,
a
the
routine
difference here is
regimen
that
of,
this is a public health
therapy. I'm not
crisis
gonna go into
that the
specifics.
president has been impacted by. It's not like he's getting fucking ass surgery or some shit. You know what I mean? It's not like he's getting. It's not like he's getting a colonoscopy or getting fucking, I don't know, some sort of like Alzheimer's related treatment. Like, he actually is afflicted by the same. He's impacted by the same disease that like millions of Americans have contracted at this point, and hundreds of thousands of Americans have died from. So of course, messaging in this circumstance is a unique one and absolutely needs to be
but I would say
cleared
that,
up.
It wasn't until after he returned that we really sat down. Then,
But
knowing,
instead they're weaponizing it.
The news of the day, that we really dove into how are you feeling? What's going on?
Those were the symptoms he was experiencing on Thursday.
I'm not going to get into, operations.
When was his last negative test, and what was his viral load?
I know everyone wants that. Yeah, I don't have his viral load. Those are some of the diagnostics that we're sending out that will really tell us when it's safe for him to get back out and around people.
The last negative test was.
Any abnormal tests? Were any of his lab tests abnormal?
I'm not, again, HIPAA kind of precludes me from going into too much depth and things that I'm not at liberty or doesn't wish to be discussed. At some future point, maybe, but today, sorry. I think that's it. Yeah.
He's gonna.
Thank you.
He's about to be like, we can't give you too much information because you know how Donald Trump says, yeah, that's a spoiler, guys. Sorry, spoiler alert. We can't give you that. Duh. I didn't even do spoiler alert yet. Secondly, you know how Donald Trump people used to ask Donald Trump like whether or not he had a plan for defeating ISIS, and he'd be like, I'm not gonna say because that would mean we're telling ISIS what our plans are. I'm not gonna do that. That's foolish. And it's kind of like that. I'm expecting the doctor to be like, I can't tell you. I can't tell you the viral load because then you're spoiling it. Coronavirus will know about it then. We can't reveal this information because then Corona will get the best of him. Yeah, we can't give more info. Otherwise, COVID would know. President can easily destroy his career if he steps out of line. If he deems his own career as more important than the integrity of informing the public honestly, then he's a piece of shit. He should absolutely be denouncing Trump's tweets that are telling the public that they shouldn't be afraid of this virus. Fuck this dog shit doctor. I mean, we already know he's a dog shit doctor. He is covering for Donald Trump. So, like, of course he's a dog shit doctor.